Okay, I'm going to go ahead and get started. Welcome, everyone. Thank you, Rashad. My name is Katie White, and I'm a health scientist in the Prevention and Response branch of the Division of Healthcare Quality Promotion. So where you all have heard a lot from surveillance branch, I work on the prevention and response side of it. So for the rest of the presentation today, what we're going to be doing is elaborating on the TAP strategy. So Rashad did a really great job of introducing the TAP reports, but as he mentioned at the very beginning, the TAP strategy is really a full framework for quality improvement. And we heard when you all did the round of applause, a lot of you are familiar with TAP reports and perhaps are using them in your facilities to identify, the excess burden of infections within your units. But what I want to highlight today is that we also have assessment and prevention components of the TAP strategy. And I'm going to walk you through some of the tools that we have available for these, the components of the TAP strategy. So we're not only using NHSN to report our surveillance data, but now we're using the data for action. So we've run our TAP reports, we've identified the units within our facility that have the highest burden of excess infections. What do we do with that, right? We want to move into the prevention phase. So right now I will discuss the assessment component. This is where after we've identified the facilities and the units that we want to focus on, we're going to be administering our TAP facility assessment tools. So what this does is allow us to identify, not based on surveillance data, but identify potential gaps we may be seeing relating to infection prevention policies and practices. So the tools I'll be reviewing are available for CAUTI, CLABSI, and CDI. So you can run a TAP report for CAUTI, CLABSI, and CDI, and then you can administer the assessments and move into the prevention components as well. Okay. So the TAP facility assessment tools are available on our TAP website, listed under the assessment link. We'll have a list of resources at the end of this PowerPoint where you can access as well. So again, they're available for CAUTI, CLABSI, and CDI. And the intent of the TAP assessments are to really capture awareness and perceptions of facility staff relating to infection prevention policies and practices. So this is where we are gaining the perspective of frontline personnel relating to either CAUTI, CLABSI, or CDI prevention practices. To do this, we're going to administer these assessments to a variety of healthcare personnel from across the facility. So we want to hear from frontline providers. So this is CNAs and nurses and physicians, mid-level providers such as IP, quality, nurse managers, all the way up to senior leadership. So what we're trying to do is gather assessments from as many respondents as we can from a wide range across the facility, because again, what we're doing is trying to capture their awareness and perceptions related to the policies and practices specific to CAUTI, CLABSI, and CDI. I've given a lot of these presentations, so I probably don't even need the slides at this point, but I know you do. We're getting there.
There you go.
Thank you. And then I think, I gotta get back up on there.
You should just be able to take it from here. Just click on it, slide it over here.
Let's try this again. All right. Good. Thank you. We're in business. Now, hopefully you can all see me over these monitors. I should have wore heels. Okay. All right. So in any case, the assessment component of the TAP strategy, we're going to administer these assessment tools. We want to hear from staff from across the facility because we want to gain their awareness and their perceptions. Do they understand the policies? Are they adhering to the policies? What are they seeing and doing on a daily basis regarding CAUTI, CLABSI, or CDI prevention? So we're going to use these assessments, we're going to collect them from a number of respondents within the facility, and then we're going to use the information to identify gaps or identify potential opportunities for improvement. And I'll show a few examples of how we can look at the different responses to identify those gaps. But another way you can use these assessments is we've often heard from from partners that they can be served as real-time teaching moments. So just by administering these assessments to staff, you're handing it out to nurses, they're taking the time to complete it. It brings, CAUTI prevention, for example, to the front of their minds. They're reading through the questions. They can stir up conversations. They might have, a question they don't quite understand. They ask a nurse associate, and, there's a conversation there, or aha moment, as we call it, and it could be cues to action. So just by administering these assessments, it can be really helpful. And what we're doing is we're prioritizing and then systematically closing the gaps. Okay, so we use the TAP reports to target the locations. We're going to use these assessments to target the actual gaps that we're seeing. Okay, so that's the whole theme of the TAP strategy. You can, but instead of just throwing the kitchen sink at CAUTI prevention, what we want to do is see what is going on within our facility and how we can really target our efforts and customize our prevention strategies. So I'm going to go through a couple examples just to kind of introduce you to the form and format of our assessment tools, but also to show how we can use these tools to identify gaps. So this is one example from our CLABSI facility assessment tool, where we are asking if the facility routinely provides feedback relating to CLABSI SIR and CLABSI rates. And this is a really great example of how divergent responses can help us identify gaps. So what I mean by that is if we collect assessments from nurses and CNAs, but also IP and quality and nurse managers, and we look at just the nurse and CNA responses, and they say no and unknown. The majority of them are saying no, I don't know what this is. We don't get CLABSI SIRs. But then we look at the mid-level IP quality manager responses, and they're all saying yes. What does that mean? You then take those data and interpret it for what it means for your facility. So this means you probably have a policy that says every quarter we provide CLABSI SIRs to the unit level personnel. What it's telling us is that the unit level personnel, they might not know where if you post it on a bulletin, they might not know where it is. They might not be receiving it. It might not be trickling down all the way to them, or they might not be understanding it, so they might be getting it, but they don't know how to interpret or use those data. So that's how this can really not only identify if you have a policy in place or if you have a lack of a policy in place, but what it actually means. You might have a policy, but do the staff understand and adhere to that? This is an example from our CAUTI facility assessment tool relating to appropriate indications domain. And this is a really great example of how this can be a teaching tool. So all of our questions are phrased in the positive. So we're not trying to trick anyone. We want them to answer always or yes. Those are the two different types of questions that we have here. And in this question in particular, say you're a nurse filling this out, it's asking if personnel use alternative strategies for management of urinary incontinence. If you're, a nurse filling this out, you're kind of stuck, you're like, I don't know, alternative strategies, what does that mean? We use catheters. So you might mark unknown, but then in the parentheses, you can see that we actually list some of those alternative strategies. So it's kind of like a cue to action. Oh, I didn't realize, bedside commodes could be used as another strategy. Maybe we should start using those more, or maybe it stirs up a conversation and, another nurse says we do use those and you should be using them as well. And then another example is within our contact precautions domain of the CDI facility assessment tool. This is a really great example of how the unknown responses can be really helpful. So for some surveys or assessments, you might get a lot of unknowns back and kind of discount them. You might think they're not as valuable. But this is actually a great example of, for a lot of our questions, the unknowns can be really helpful. We do get a lot of unknowns, but we can use those to help identify gaps. So this question asks, are contact precaution signs used for rooms to designate patients with confirmed or suspected CDI? If we get a lot of unknowns, you take that as your, back to your facility, and how do you interpret that? Well, there's a few ways. If you don't have a policy for using contact precaution signs, you would interpret that you don't have a policy. That's why they're saying unknown. And a next step might be to implement a policy for that. If you take that back and you do have a policy, then perhaps the unknowns are indicating they don't know what the signs mean. Maybe they're not interpreting them. Maybe the signs aren't clear. Maybe they're not posted, low enough on the door frame that the staff can actually see them before entering the room, for example. So it allows you to kind of take it and say, oh, they don't know. that's not the only thing here. It's that perhaps, there's something more to it, for example, with the contact precaution signs. And then the last example is within our environmental cleaning domain, again, within our CDI facility assessment tool. And this is where it's really helpful to identify on-the-floor practices, really from the view of frontline personnel. So this is asking if shared medical equipment is cleaned between patients, and then if there's a clear delineation between who cleans what. So does EVS clean certain items, and do unit level personnel clean certain items? If you have never, rarely, or sometimes responses in these questions, this is where you can kind of see you might have a policy that says, unit level personnel are supposed to clean the shared medical equipment, EVS cleans, the rooms or whatever. If you're indicating a gap here, it might mean that you have a policy for that, but the frontline personnel are telling you that, there's a disconnect. They're not understanding it, or, the EVS thought that nurses were cleaning it and the nurses thought EVS was cleaning it, for example. So just a few example questions, the format. All of our CAUTI, CLABSI, and CDI assessments are similar in format, and they can all be really helpful to, take a deeper dive and identify gaps. So how do we deploy these assessments? You guys have a lot of information coming at you. It's only Monday. You have a long week ahead. All the information that I'm sharing today, we have available online. We have a tool guide that walks you through it step by step. I really hope that this presentation is more just like an introduction to additional tools that we have available. I'll say it a number of times, but our team at CDC is here to offer technical assistance. So if you get back to your facility and you want to do one of these assessments, you can just email us and let us know. We'll walk you through it. We'll provide the assistance. So you don't have to take any of this, away today and have to implement it tomorrow. We are here to facilitate, and we do have tools and resources for you. But how are we going to deploy these assessments? So we want to collect assessments from facility-wide personnel. So this is your senior leadership, mid-level leadership, IP, quality. For CDI, environmental cleaning, that's an important group to gain responses from. If you're looking at CLABSI, maybe you have a line insertion team that you'd want to get responses from. So people that really work across the facility. And then we're going to collect them from frontline providers within the units. Based on your data, you can collect assessments from multiple units across the whole facility. Or if you've run a TAP report for CAUTI, for example, and you've identified 3 units with the highest CAD, you can collect the assessments just from the staff within those select units. Okay, you still want to collect facility-wide, like the leadership levels, but based on your data, as well as other contextual factors, you may choose to select a couple units or go facility-wide. In order to actually disseminate the assessments, we have a number of different deployment methods. We know that each facility is unique, so it's important to consider, what may work best for you. We have them available on paper form, where they're on our website. You can print them out. We have a SurveyMonkey template available. They are also in Adobe PDF fillable form, and then we also have REDCap templates. And it's important to note that deployment may include a combination of methods. So most facilities find it helpful to pick, the 2 methods that would work best for them, just to, encourage participation. So for paper forms, again, this is what you can print out and you can have staff complete by hand. You can do it, during a training or an orientation where you have kind of everyone's attention at once. You can provide a stack of blank assessments and then a drop box at the nurses station and have staff kind of complete it throughout the day. And this is just nice because it removes any technology barriers that may arise. SurveyMonkey, we have a template. So if you have a paid SurveyMonkey account, we can send it to you and you can deploy it as you normally would with any other SurveyMonkey. If you don't, we can give you a live SurveyMonkey link. So if you don't use SurveyMonkey at all, that's okay. Just reach out to us. We'll give you a link. You send that out to staff and we can still deploy the assessments that way. SurveyMonkey is nice because you can email the link, you can post it to an intranet site, you can pull it up at like a shared nurses station, the shared computer or tablet even, and they can take turns completing it. So that's just a really kind of seamless modality. They are available in PDF. So these are what's on our website. So the PDFs you can print and just do paper, or they can be completed electronically. To complete them electronically, there is a submit button at the end of it. Staff have to have access to computers. So this might, to email addresses and computers. So this might be best for like kind of the mid and upper level leadership that have readily access, to computers and their emails. The PDF may be a good modality for them. And then lastly, REDCap. We created the REDCap template so we can provide those to you, but your program would have to use REDCap, so it's something that you'd already be using within your facility. But if that's a modality that you use for other assessments or surveys, we can provide the templates that you can import right into your REDCap account and distribute that way. Okay, so a poll everywhere question that I will attempt to do, and I'm not sure if it'll work. So prior to today, were you aware of the TAP facility assessment tools? I didn't click anything, but it's working, so I'm going to go with it. All right, so we have quite a mix. A lot of them have been used in a lot of facilities. That's good to see. So as Rashad was saying at the beginning, a lot of people are familiar with the TAP reports, but not as familiar with the additional tools that we offer for the complete TAP strategy. I'm glad to see that, some people are familiar and have even used them. But if you have used them, again, you might have used them for CODI or CLABSI or CDI. We do, of course, have them available for all three, so it may be something that you'd like to explore with another HAI. Okay. These might be answers from... Does it automatically reset when I turn the screen? Okay. All right. If you were to deploy the TAP assessments, which method or methods do you think would work best for your facility or program? So think of what might work best. So if you were at your facility and you were ready to deploy the TAP assessments, which method, maybe have you used before, or which do you think may be best for you? SurveyMonkey is one of the most popular deployment methods. It's just seamless. A lot of people are familiar with it. Sometimes with the PDF, you have to attach it to an email. Sometimes firewalls get funky and can block that. Paper is always nice so that staff can kind of complete it on the go. But just something to think about. Okay, so we've deployed the assessments. Now we have to summarize them. We're going to keep using our data for action. These assessments are going to provide a wealth of information and data that we want to be able to use to truly target our prevention efforts. So to do that, we're going to compile all of our assessments. And again, don't get overwhelmed. This is just to kind of introduce you to the way that we can use these tools. But if you receive them on paper, we're going to do data entry. If you receive them electronically, regardless, SurveyMonkey, PDF, REDCap, we're going to get them into Excel. Again, we at CDC can assist with this. If you complete 200 assessments on paper, you can mail them to us. We'll do the data entry and we'll summarize them for you. But we also have a tool guide that, again, walks you step by step through all of these processes. So all of the TAP assessment or all of the TAP tools, not just the assessments, but all of the TAP strategy tools are available to you. So you can take them, you can use them within your facility. You don't have to contact us at all, or they're available with our assistance. So just keep that in mind. We are here to support your deployment efforts as needed. So really the goal here is, again, whether they're paper or electronic, our goal is to get them into Excel. So we have Excel spreadsheets for CODI, CLABSI, and CDI that all look almost identical, but they all look like this. And our goal is to get all of the assessment responses in here, because what this Excel is going to do is help us summarize the assessments. We're going to create a feedback report. So this is the first page of a feedback report. Don't worry about reading the text. I'm just going to show you kind of the content that is summarized in these reports. But this is after we've collected all of our assessments. So sometimes this gets, because we use the word report. This is not a TAP report. TAP report is in NHSN. These are assessment responses. So these are all of the assessments that nurses and physicians collect and complete. We're going to put them in that Excel, and it's going to spit this out. And to do this, what we're going to do is in that Excel spreadsheet, we're going to create this feedback report, and we're going to use this to identify our gaps and our opportunities for improvement. So what does this show? The very top here provides infection data. This is from NHSN. You populate this. This is not linked at any way to NHSN, but this is where you can enter your facility level data to kind of give a snapshot of where you are. If you're working with a CAUTI work group, or if you want to present this to leadership, it kind of gives just a good snapshot of where your facility is with the CAUTI, or in this case, it's a CLABSI feedback report. The bottom half of this first page, this is a full picture of all of the gaps we've identified, all of the potential opportunities for improvement we've identified. Each of the different sections, so the orange and the purple and the blue, these are the domains within our assessment tool. So each assessment tool has 5 to 6 domains. The first one being general infrastructure. This is for CLABSI, so it's appropriate use of central venous catheters. Those are the domains. And then underneath each domain header lists the questions for which we've identified as a potential gap. Okay, so this is where we're looking at the unknowns. We're looking at the no responses, the unfavorable responses as we call them, and we flag it as a potential gap here. Okay, so this is a full picture of all of the gaps from all of the domains that we have captured within your assessments. And then in the middle, we can see the green leading and the red lagging sections. The leading is where your facility is doing well, so where the majority of respondents answered favorably. So they said yes or often and always. And it's really good to just kind of highlight, where you've got strengths. And then the lagging section is really just a higher level summary of the gaps that we found. Okay, so the bottom half is everything. And then the red lagging allows you to then kind of prioritize and select which gaps are most meaningful for you. Okay, so there's a lot of information. This is, again, just the first page of the feedback report, but it provides a really nice snapshot that your facility can review and work to help identify the specific target areas. The rest of the pages in the feedback report contain each question within the assessment, and then it breaks it down by frequency of responses. Okay, so you can then see on the first page where under the general infrastructure domain, the very first cell says nurse and physician champions. That was identified as a gap. You can then go to, and it's the wrong page shown here, but then you can then go to the exact question and say, why was this identified as a gap? Well, it's because, 20% said no and 35% said unknown. It also highlights in green where the majority of respondents answered favorably, but it allows you to go question by question and see the frequency for each one. For each of these assessment feedback reports, we've applied a scoring methodology. We've done this so that we have another way to use our data for action. We're continuing the theme of using data for action. But it's important to note that these scores that are applied to the feedback report are not meant to measure performance. They're not meant to compare one facility to another facility. They're not linked to NHSN. There's no implications based on the scoring other than to help further identify gaps. So for example, if this overall assessment score was 65%, we're not saying if it's pass or fail or good or bad, but for the CDI feedback report, we get a breakdown by domain of the scores. So what we can see is, if I were this facility, maybe, I'm not going to base it solely on these scores, but maybe we want to take a look at the antibiotic stewardship domain because that has scored much lower than the others. We also show respondent demographics within our feedback report. This is just where we show the frequency of nurse and physician responses, ICU versus non. But we have the scores shown here. So this is another way that we can use the scoring to further identify gaps where the nurses scored 52%, physicians scored 73%. We're not scoring, comparing whether one's better than the other, but what it tells us is we perhaps might want to explore the responses to the individual questions separately. Okay, so we might want to take a closer look at just the nurse responses and just the physician responses. All right, so I'm going to do a quick demo, if I can pull it up. So this is all dummy data, but I wanted to show you the Excel spreadsheet that we had talked about. So after you collect all of your assessments, they're going to go into this Excel spreadsheet. Again, we can email this to you. You can do it all on your own. We can create this for you at CDC as well. So essentially what you see here is each assessment has its own row. And this is just the respondent demographics. So the unit name, the unit type, the respondent role, so whether they're nurse or physician. And if you scroll to the right, this is where all of the questions are summarized. Okay? On the very bottom left-hand corner, right down here, you can see input data and then feedback report. So we're putting all of our data in here, and then the feedback report shows, and don't worry about reading the text, but this is the feedback report. So the whole left-hand side shows instructions for use. So we also have a separate guide, but then this just walks you through how to make the feedback report. Again, we can do it for you, but this will guide you through it. And then the right-hand side is our actual feedback report that we're creating, okay? So this is the first page where you can, put your facility level data if you'd like. This is where we summarize the leading and the lagging sections, the overall gaps. And what I want to do is just highlight some of the ways that we can use this Excel spreadsheet. So let me zoom in a little bit. So with this assessment, we have 53 assessments collected. So there are 53 assessments entered on that input data tab. We have an overall score of 61. And let's use that example of the antibiotic stewardship domain. So we can see these are the domains within the assessment tool. And antibiotic stewardship scored 52%. Okay. Maybe we want to take a closer look at those questions. Let's see what those responses were, because that one was the lower scoring domains. Pardon the scrolling, but if we scroll down, we see each of the question frequencies here. We're going to go to the stewardship domain. Okay, this is the stewardship domain, and this is why this was scored low. You can see there's a lot of unknowns. The red is where we have 33% or more of our respondents indicating unknown. And then for these questions, we have 50% or more that answered unfavorably. So this is why we're seeing this domain scoring low on that first page. But some of these questions are pretty technical, like the whole 4, 5, 6, 7, 8, and 9. These are asking if your facility monitors the use and then uses strategies to reduce the use of high-risk antibiotics. So these are pretty technical. We're asking about fluoroquinolone use, cephalosporin use. If we have a lot of nurses that answered this assessment, we may not have a clear picture of the gaps here. So this would lead us to think, let's look at just the physician responses. We're going to go back to our input data tab. And in our respondent, can you see my mouse? I'm trying not to make you too dizzy here. But for each of these cells, you can see there's a little gray arrow under the respondent role because we want to look at physicians. We're going to click this little arrow, and we see all of the options that we have in this row, in this column. I'm going to deselect all of them, and then I want just physician. Okay, so we're clicking the two that are physician, clicking OK, and now we're looking at just physician responses. If we go back to feedback report, we still have 53 because that's the total, but the number analyzed is now 14. Can you all see that? Where now we're looking at just 14 physicians. The scoring changed. It was, I think, 61%. We're at 56%. These scores changed. Now we're up to 57 for stewardship. The text does not change. That is manual, but all the numbers do. So if we scroll down, this has updated. Now we have 14 physicians that are 100% of these respondents that we're summarizing. And then all of the question frequencies updated. So let's go back to stewardship. And now we see that we don't have as many unknowns. These bottom 6 questions are not flagged as gaps, because the physicians are more aware of the policies relating to antibiotic stewardship within this facility, which makes sense. So what this tells us is that the facility probably does have a system in place to monitor and reduce the use of these antibiotics. And these are the personnel that should know that. But what's important is, let's take a look at these two questions. These are still flagged as gaps. It's not because they don't know. Some of them don't know, but that's important to know as well. But you have a lot of never, rarely, and sometimes. So we're asking, does your facility educate providers about the risk of CDI with antibiotics? They're flagging that as a gap, as well as reviewing antibiotics for new or recent CDI diagnoses. So that's where there is an opportunity for improvement. If we go back to look at just the nurses now, we go back to our input data tab. You could tell there's a filter applied because there's a little filter icon. You're going to click that, and we're going to deselect them all, and we're going to click just the nurses. So I'm nurse assistants and techs, nurse, and then a nurse administrative leadership. Click OK. Back to our feedback report. Still have 53. Now we're down to 34, though. These are just our nurses that we're looking at. The score changed. These all changed. This was 57 in antibiotic stewardship for just the physicians. Now we're down to 50. So let's scroll down. Again, this updated. We have 100% that are nurses, split between ICU and non. And if we go to the stewardship domain, these bottom 6 questions, this is why they were flagged in the overall report. This is why it's helpful. If you get enough assessments from all these different respondents, you can do this. If you have 2 physicians and 50 nurses, which is not uncommon and it's not a bad thing, it's just you won't have the power to be able to kind of slice and dice the data. But this is why it's helpful, because these nurses are mostly, majority of them are saying unknown. What does that mean? Well, they're not prescribing antibiotics, so they may not be aware of, the particulars of your stewardship program. But still an opportunity for improvement there. They are an integral part of, CDI prevention and patient care. They should be aware maybe of the stewardship practices. So not that they're prescribing, but it might be an opportunity to educate them on these items. What's really important here is to still look at these 2 questions where they're not flagged because of unknowns. They're flagged because of the unfavorable responses, where does your facility educate providers? Nurses should be educated about the risk of CDI with antibiotics, and they're saying that they're never, rarely, or sometimes educated. So that's an opportunity as well. What's also interesting here is this question 3. It's not red. It's not technically a gap based on our criteria, but our criteria is not set in stone. It's just set so that we can help identify gaps. It's not the end-all, be-all. So what this means here is it's not a gap, it's not a strength, but let's look at the frequency of responses. We should still explore all of the questions and all of the frequencies, because what we're seeing is that we have like 40% here that are saying never, rarely, and sometimes. Not enough to flag it as a gap, but when we're asking, does your facility educate patients or family members about the risk of CDI with antibiotics? If you've got nurses and CNAs that are saying, 40% saying never, rarely, or sometimes, that's an opportunity for improvement, because, they have so much direct patient care and, interface with the patients and families. They might be the ones that are supposed to be providing that education, right? So this is just a useful tool that, in addition to the actual feedback report, you can use this Excel spreadsheet to kind of slice and dice the data to really dig down to see what your actual gaps are. Because again, the goal is to use all this information to further target our prevention. Okay, we want to customize the prevention strategies to, whether it's nurses or physicians, you might have different gaps across different units, and you can use those data and that information to identify, where you need to be focusing your efforts. If we go back to input data, again, we have the little filter icon. If we select all of them and click OK, that filter icon disappears, and now we're back to viewing all of them. And we know that because if we go back to the top, we collected 53 and we're seeing 53. Okay? So this Excel spreadsheet is just really helpful. If we, work with your facility to deploy assessments, you will get this back, and you can use it to, further review your data. All right. Okay. So we're almost done. Thank you for hanging in with us, and then we'll set you free soon to do an activity, and then actually free to go on with your evening. Okay, so we've used our data in the TAP reports. We've targeted We've used the CAD to identify the excess units. We've deployed those assessments. We collected them all. We created the feedback report. We know where our gaps are. But now what? We want to move on to the prevention component. And this is what is most important. Our goal here is to prevent infections. And it might seem like a lot of work to do the TAP reports, to collect all those assessments. That can be a lot. You got to make this feedback report. But the goal here is when you get to this prevention point, you know what your actual gaps are and you know where you need to prioritize, your efforts. So the goal is to really maximize your resources. So it might seem like a lot, but the goal here is to really help with prevention. So one way to do that is to use our TAP implementation guides. These are also available on our website under the Prevent tab. They're available for CAUTI, CLABSI, and CDI. And what they are guides that mimic the assessments and the feedback report. So these domains that are listed for each of the HAIs, they are the same domains on the assessment tool and the same domains on the feedback report. So say you identify a gap in one domain, you can go to the corresponding domain here. What they do is they list actionable tools and resources from partners. We do have some CDC tools. We have our guidelines, but we tried to select tools that are already existing that are used by people across the nation that are actionable. And I'll show a couple examples, but it's really just a useful resource for our partners. And we want you to do the whole TAP strategy, but one benefit of the TAP strategy is that you can pick and choose. So if you are at your facility and you don't have the time or capacity to do the assessments or even run a TAP report, but you need some CAUTI prevention tools, these are available for you right on our website. So to kind of tie it all together, let's pretend we deployed the CDI TAP assessments. We made a feedback report, and on our feedback report, we identified C. diff testing as one of our gaps. This is in the early detection and appropriate testing domain. So we're going to go to our implementation guide, the CDI implementation guide, the same domain, early detection. And then we can access one of these testing algorithms from Vanderbilt, actually, that your facility can download and implement right away. You can also use it as a template, as an example. You can modify or adapt it as needed. But this would be an actionable tool that can help address your gap of appropriate testing for CDI. Another example for CLABSI within the proper insertion practices domain is shown here. It's one of the vascular catheter insertion checklists. So this is another tool that might be useful for your facility as is, or you might use it as a template or an example and adapt it as needed. So what have we learned? We've learned a lot. So let's kind of just recap. The TAP strategy, again, 3 components: target, assess, prevent. Rashad showed us how we generate TAP reports. We have generated a CDI TAP report. Our CAD was 22.48. We're going to round that up. So we've identified that we need to prevent 23 infections based on our SIR goal of 7. We administered our TAP facility assessments. We did this across the facility, or you could do it within select units, collecting from frontline providers, mid-level staff, and senior leadership. And then we created our feedback report and identified and prioritized potential gaps within the specific domains within the feedback report. And within our implementation guides, we accessed actionable tools and resources and implemented strategies to address those gaps. So again, we're really targeting it on every level here and trying to maximize impact with limited resources. So how do we get started? We have all this information, all these tools, but where to start? One helpful tool we have on our TAP website is our how-to guide. This is a kind of a step-by-step tool that walks you through how to run, how to interpret a TAP report, really how to use the TAP strategy. And a couple tips for success that we've often heard from our partners. We collaborate with partners from across the nation. And one thing we've often heard is that working with the partners within your region, within your state, within your network can be really helpful, especially with TAP. So state health departments, hospital associations, QUINs, HINs, a lot of them are using the TAP strategy. A lot of health departments are using the TAP strategy. And if you reach out to them, they will be more than happy to offer assistance for the deployment. And we, of course, at CDC are here to offer assistance as well. It's important with any quality improvement framework to really align your prevention efforts within your facility. So, some facilities might just be starting out with CDI prevention and they want to do TAP. They do an assessment, they identify their gaps. It's a great place to start. You might have other facilities that, have done a lot of CDI prevention work. They might administer the TAP assessments to just see how they're doing and see, if there's any gaps that they, may have otherwise overlooked. It can really garner additional information that they may have not, realized otherwise. So it can really align with any step of prevention that you all are at. And then specifically for deploying the assessments, aligning the assessment deployment with your prevention efforts. So doing it during training or meetings or at a time within your facility that would be best for you. The assessments, they take like 5 to 10 minutes to complete per staff member, but from what we've heard from partners, it's one of the greatest barriers to implementing the TAP strategy. It's like another survey, like we don't have time for this. But if you can get over that hurdle, and by doing that, aligning it with work that's already going on in your facility, it can garner a lot of helpful information. In the same note, exploring assessment deployment options. Again, doing what is best for your facility. Don't try to use REDCap if you've never used REDCap before. Maybe SurveyMonkey or paper would be better. And then leadership support. It's really important, again, with any quality improvement work to really, gain the buy-in from your leadership. This is at facility-wide, but also unit level. So if you're deploying the assessments within an ICU, have an ICU champion that just stays on staff and say, all right, guys, let's get these assessments in. It's going to really help us in the long run. So kind of along those lines, a few tools we have that can help gain buy-in. So say you're sold on this. We've done a great job, hopefully, with our presentation. You go back to your facility and you want to do this. How do you engage leadership and others at your facility? On our TAP website, we have what we call the TAP infographic. This is a one-pager. It's very high level. It doesn't get into too many of the specifics, but it can offer kind of a description of what the strategy is that you can provide. You can download, print, email, provide to leadership. We also soon, they're not quite posted yet, but soon we'll have the TAP strategy testimonials from partners. These are like success stories and lessons learned and, tips for success, basically, from partners that have actually implemented the TAP strategy. So you can review this and get some, helpful information, but you can also show to leadership and say, here are facilities and health departments that have used this and found it to be helpful. Sharing TAP report data. I think you probably know this, being at an NHSN training, that, sharing data within your facility and to leadership can be really helpful. And the CAD is really helpful because it translates the SIR into a concrete goal. It's a number. Our facility will have to prevent 23 infections to reach our goal. That can be really helpful to share with non-IPs, people that have not attended a week-long training, don't have a great grasp of the SIR. The CAD can be really helpful. And then lastly, sharing a sample feedback report. So that complicated feedback report I introduced, we have sample ones for CAUTI, CLABSI, and CDI that are populated with dummy data that you can share with leadership and say, hey, if we get 50 assessments completed, this is what we will get in return. And this is the type of information. It's kind of a tangible end product. And what I think is most important is share with your leadership the assistance that you have available. So again, health departments, HINs, we at CDC are available to facilitate all of your deployment efforts. So you're not in it alone. See it as a resource. So not only are all these tools useful for you, but we can partner with you and serve as a resource as well. So all of our TAP tools and where to find them are listed here. We have a lot. This is a lot of information. So this is kind of just can serve as a resource to you moving forward. If you're like, all right, I'm ready to do assessments, where do I find that? You can go here and see where to find the tools. We also have additional resources like FAQs. NHSN has a lot of quick reference guides. They're videos that will walk you through step by step how to run a TAP report, how to interpret a TAP report. The HII progress reports that are linked to TAP reports, all good information here. But second most important thing are email addresses. So anything specific to TAP reports, NHSN at cdc.gov, but anything else TAP related, and if you don't know, you could still email this one and we'll get it to NHSN, is HAI prevention at cdc.gov. Okay? So any questions, any requests for assistance can go there. And I will turn it back over to Rashad, where we're going to do a very exciting activity.
Thank you very much, Katie. So we want to go into the activity, and we also want to get to your questions. So here's what we're going to do. I will put up the activity. Okay. So we'll get started on the activity, and then once we get the activity going, we'll try to work in allowing you a chance to go through the assessment and prevention pieces of the activity and ask questions at the same time while we're doing that. Is that? That'll be
That's good.
okay. And then, of course, after we finish, once we wrap up, we're more than willing to stay behind and answer any questions that you have. Okay, so going back to the Scott Decker Health Institute that we were working with earlier, this is the facility that we're going to use for our exercise. So it's the same TAP report that we saw earlier. If you recall, this is the facility that had an SIR of 0.706. So they wanted to push the envelope as far as an SIR goal. And this report actually uses an SIR goal of 0.5, which results in a facility CAD of 14.6. And we see the location ranking for its top 10 facilities in the unit. Okay, and so from here we are going to have four questions that are strictly based on the TAP report, making sure you all gathered or are able to pull out the information that we have here. So, question number one: given that this facility already has an SIR of 0.706, give an example of an SIR goal that the facility could use to target CAUTI prevention. Question two: where is the facility CAD, and what is the facility CAD? Where can I find the facility's SIR, and what is the facility's SIR? This facility could dramatically decrease its number of events by targeting infection prevention in which locations? And how many infections would this facility need to prevent to reach the SIR goal? And how many infections could be prevented by targeting ward locations ranked in the top 5? So this information is not in the packet that you were throwing through the packet. No, I'm sorry. This information is not in that packet, okay? But we're going to, after we answer these set of questions, you will be able to defer to the packet for the second set of questions.
So the sheets that we handed out right before this, we'll get to those in a moment. This is just presented up here.
All right. Okay. All right. So okay, so question number one: given that this facility already has an SIR of 0.706, give an example of a suitable SIR goal that the facility could use to target CAUTI prevention. And if anyone would like to venture to one of the microphones to give an answer, we can do it that way. It's already given it. So by the lack of volunteers, I'm assuming all of you are just being really modest. All right. So given that this facility already has an SIR of 0.706, simply that they would just need to pick, they could pick 0.5 or a value less than 0.7. That could be 0.25 or 0.3, 0.4, whatever, as long as it's already less than their given SIR. All right, so question number 2, where's the facility CAD? What is the facility CAD, and where can I find the facility's SIR, and what is the facility SIR? So if we go to our TAP report for that question, again, if you recall, the facility information is always going to be found in the facility columns. So the facility CAD, if we look there, is 14.6. And then the next question was about the facility SIR, where it is and what is it. And the facility SIR would be found in the SIR reports. You're not going to find it in the TAP reports. The purpose of the SIR reports is to give you that facility, is to give you your SIR information. So you're not going to find it in the TAP report. But what you will find is you'll find the location CADs as well as the location SIRs. Okay. And then question number 3. This facility can dramatically decrease its number of events by targeting infection prevention in which locations? So if we go back to our TAP report, so which locations would we need to focus our attention on? I'm hearing answers, but well, I heard the top 5, the top 3, all correct answers. So we would go to our location ranking, and based off of the locations, location ranking, that's the location given to as a result of the CAD. The locations with the highest CAD are going to be ranked first. So we wanted to target those locations with the highest CAD. They would be the ones that are highest in our ranking. Our top 5 being 1 East, 2 East, 2 West, ICU 1, and 1 West. And that leads us into question 4. How many infections would this facility need to prevent to reach the SIR goal? How many infections could be prevented by targeting the ward locations ranked in the top 5? So how many infections we would need to prevent to reach our SIR goal would be not 14.6, but 15 exactly. You can't prevent that fraction of an infection. So we would have to prevent 15 infections. And if we were looking at our top 5, in 1 East, the CAD is 2.59, so we would round that to 3. 2 East is 2.4. We would also round that to 3. That's so if you're keeping total, we're at 6 infections now. 2 West is 2. Very good. And then our other ward location in the top 5, our other ward location in the top 5 would be 1 West. If we're looking at the CDC location, these are our ward locations, and it has a CAD of 1.72. So we would have to prevent 2 infections in the ward location. So 6 plus 6, I'm sorry, 3 plus 3 plus 2 plus 2, because 4 of our top 5 locations are ward locations, that would be 10 infections. Okay? All right, so now we will move on to the assessment and prevention pieces. she didn't have that one open. Emily.
No top report.
The other PowerPoint.
While they're pulling that up, so what we're going to do now is the packets that we handed out, each person should have 2 pages. They're front and back, so there's 4 pages total. And that's going to continue on to this example. So we're using the same facility, Decker Health Institute. And we'll pull them up on the screen in a moment, but you all can start working individually and as a group, read through the questions and the scenarios, and you can write in your responses. Some of us will be circulating, so if you have any questions, flag one of us down. But here we are with the example where we ran the TAP report for CAUTI, as Rashad just went through, and our CAUTI work group at Decker Health Institute, we reviewed the TAP report data, and we decided to deploy the TAP facility assessments for CAUTI within the units that you all just identified, 1 East, 2 West, ICU 1, and 1 West. So we collected all of those assessments, and we created the feedback report that we see here. So this is what is on the very first page, and we'll give you a few moments to complete the questions here. And you can kind of work at your own pace and go through it. Again, we'll be circulating if you have any questions. And then once we give you a few minutes to complete it, probably we'll give you like 8 to 10 minutes to complete the exercise. We'll all come back together and look at some of the answers we have. So feel free to discuss amongst your tables, flag us if you have any questions. Okay. We're going to bring it back just for the last few minutes. I hope you all enjoyed that exercise. We're going to go through the answers just really quickly. So if you all have any, burning desire to know the actual answers, we don't want to leave you hanging. Okay. So again, we reviewed our TAP report. We administered the CAUTI facility assessments within those units that we identified. And the first question was, how many TAP facility assessments were collected? Shout it out. All right. Name one area for which this facility has a strength relating to CAUTI prevention. All right. Anything in that green? Perfect. Name one area. Sure. For number 5, number of assessments collected was 54. This is for the folks on WebStream. And you can see that it's 54 because under the assessment overview, we can see the number collected was 54. Name one area for which the facility has a strength. This is going to be anything in that green leading section. One area for which the facility may have an opportunity for improvement relating to CAUTI prevention. It's going to be anything in the bottom half, anything underneath those specific domains. Those are each gaps or opportunities for improvement, or anything in the red lagging section. Okay. All right, that was the first page. Then we took a look at the respondent demographics section of the feedback report. So when we look at this table, this is where we see the nurse and nurse assistants, the physicians. We get the breakdown of unit type. Looking at this respondent demographics table, how many were nurse or nurse assistants? 30. We could see that the number of respondents for nurse and nurse assistants was 30. What was their overall mean score? 68%. Good. This is pretty basic, but there's a point to it. How about for physicians? Number of respondents? 21. And the score? 53. So based on the scores for these two groups, for physicians and nurse assistants, what additional steps might this facility choose to take when reviewing their TAP assessment data? So what might you do with these data? Good. You could filter. So what we want to do is then, because the nurses scored 68 and the physicians were at 53, we're not saying if one is better than the other or, one's smarter than the other. But what it says is maybe we want to look at the questions and the frequency of responses individually. So we're going to filter that Excel and we're going to look at just the nurse responses and just the physician responses. Are there any additional respondent groups for which this facility may want to review the results? So based on the respondent demographics here, are there any other groups that you'd like to explore? I hear it. ICU and non-ICU. Because you can see here under ICU, the score was 58 and non-ICU was 71. That just leads us to think maybe we should be exploring these question frequencies independently. Okay. So with all the information we had so far, the CAUTI work group at Decker Health Institute decided to explore the TAP assessment frequencies independently for just the ICU and then again for just the ward locations. So to do this, we filtered our Excel spreadsheet by unit type. And when the facility filtered this, the following data displayed. So the top is the ICU, and this is just little snippets of our feedback report, but the top is ICU and the bottom is wards. So you can see when we filtered to ICU, we have a different assessment overview and different respondent demographics. So how many assessments were summarized for the ICU compared to the ward locations? Exactly. So ICU completed 19 assessments. We know that because the assessment overview will show 54 that we collected, but for ICU, when we filter, we're looking at the results for just 19 of them. And for the wards, we have 35. This is the total for all of the wards. You can also filter by 1 east or 2 west. You could filter by the actual unit name if you want to just look at one, or the unit type. So how do the data for the ICU responses presented in the respondent demographics vary from the ward responses? Are they identical? Great. So there's a few different ways that we can answer this. So right off the bat, the ward had more responses. One thing we want to be mindful of is as we get filtering, if you only have 5 assessments from the ICU, might be helpful to review it, but use extreme caution, because when we have responses that are nurse and physician and CNA, their perceptions and their awareness, it's not, do you have a policy in place, yes or no, coming from an IP. You're gaining staff awareness and perception. So when you have a few number of assessments, 5, 10, even 15, you have to use caution in interpreting those data. So it's always important to kind of see, we've got 19, we have more in the wards. 19 is still a pretty good number, but we just want to be mindful of that. We can also see too that within the ICU location, when we look at nurse and physician, we have a lot more nurses. We have twice as many nurses as we have physicians, and that's okay too. It's just something that we want to consider when we're looking at the responses. Whereas in the ward location, we have not quite 50-50, but an more even distribution of the types of respondents. And then, of course, between the two, the scores both vary still between the respondent types. All right. So we filtered, and now we're looking at the individual response frequencies. And we've selected a couple questions that this facility thought was interesting. So how do the data above vary among the ICU and the ward responses? So these are the same questions, but different frequencies, one for ICU and one for wards. How do they differ? One's red and one's green. So what we're seeing is that for these questions, these all relate to bladder scanner use. So whether they use bladder scanners to confirm urinary retention before insertion, with intermittent catheterization for post-op urinary retention, and then if they provide instructions or protocols for personnel to act upon the bladder scanner results. So in the ICU, this is identified as a potential gap. This is somewhere where we can go to this ICU and say, all right, we need to work on bladder scanners. Let's see what we can do. The wards, it was actually identified as a strength. So the majority of respondents in the ward locations are saying that they often and always use the bladder scanners before insertion and post-operatively. How might Decker Health Institute use these data to customize and target their CAUTI prevention efforts? So I kind of just gave it away. We would go to the ICU perhaps and focus our efforts there regarding bladder scanner use, bladder scanners. Now, the best question. So we know that there's a potential gap identified within the ICU regarding instructions and protocols for personnel to act upon bladder scanner results. So this is question 6. Do they have instructions or protocols to act upon the bladder scanners? This was also identified as a potential gap within the overall feedback report. So on page 1 of the sheet, we saw this was a potential gap under the appropriate indications domain. This is the overall feedback report, all 54 responses, and it was flagged as a gap here, instructions and protocols for bladder scanner results, okay? So we know that. Based on this information, should Decker Health Institute implement interventions to address this gap in just the ICU location? Why or why not? Anybody? No? All right, you're all being shy. So the answer might vary. This is where it's helpful to be at your facility. So we might create this feedback report for you and provide it to you. It's going to be based solely on the response frequencies. You take this information at your facility and you see what works best for you. If you are really trying to target the highest priority areas, you might only focus on the ICU regarding bladder scanner use. But if you really want to identify additional opportunities for improvement, if we look at the ward responses, we have their strengths regarding whether they use the bladder scanners. It's not a weakness, question 6, but if you look here, you've got like 40% that are saying never, rarely, or sometimes. So 40% of the respondents within the wards are saying that they never, rarely, or sometimes have protocols or instructions to act upon bladder scanner use. Okay? So if you want to cast your net a little wider, if you're already, maybe start implementing an intervention within the ICU and then expand that to the ward location. But just something to consider where it's not just what's in red, but to look at the full picture and do what's best for your facility. Okay? So that concludes this session. Thank you all for your undivided attention.